Okay, in 5, 4, 3, 2, 1. Lorna, over to you.
Good afternoon, everybody. Thank you for joining us again on our weekly COVID-19 media briefing. I am Lorna Virgili, Hispanic Public Information Officer for Montgomery County Government. Mr. County Executive Marc Elrich will be joining us in just a few minutes. And we do have with us today Dr. James Bridgers, who is our Deputy Health Officer, and also Dr. Earl Stoddard, who is the Director of the Office of Emergency Management and Homeland Security. Reporters, you know the drill. Use the chat box to ask permission to record and also to post your questions later on. Let's get started with Dr. Bridgers as we wait for the county executive. Dr. Bridgers.
Good afternoon, everyone, and thank you for allowing me yet another time to give you a public health update on behalf of Dr. Gayles. I think our last update was given to this body on Monday, so there are a couple of changes. Some things have changed the same, remained the same, and so I'd like to share with you those updates at this time. So first, beginning with community transmission, as of Thursday, today, our cumulative case count is 52,368. We have 474 cases, and our 7-day average of new cases per 100,000 is 49.8%. Community transmission levels remain high, representing a post-holiday increase in cases. At the end of last week, 4 of the hospitals were in a red zone regarding capacity, with 1 other in the yellow zone. Additionally, the remaining hospitals will not be near capacity limits, but we've been in conversations with those hospitals to determine if and where there need to be any additional interventions or recommendations on behalf of the health officer. I do want to share with you that as of this past Sunday, we saw the highest single daily case reported of 639, as well as the single highest 7-day average since mid-December, which was 74 cases, which is actually the same amount of cases that we've seen today being reported. We continue our widespread community testing network in partnership with numerous community agencies, including the exceptional efforts by our African American Health Partnership and our Latino Health Initiative regarding that. Our weekly total last week was 12,000, testing total was 12,244 across 25 spaces, including our employee testing. Now, I'd like to give you an update regarding the variant strand that was reported by the Maryland Department of Health earlier this week. There have been no additional update regarding those 2 cases of the UKB 1.17 variant strain reported in Maryland again this week. Our conversation with the Maryland Department of Health is that their guidance and their continuing guidance along with CDC is that to slow the spread of this variant, as well as the coronavirus specifically that we've seen previously, is to wear masks, stay at least 6 feet apart from others, avoid crowds, stay in well-ventilated indoor spaces, and wash hands as often as possible. That is a recurrent message. It is a specific message, and it is a needed message that we all need to reinforce. Now I'd like to move in to talk a little bit about vaccine capacity. And then once I go through the vaccine capacity update, I'd like to share with you what we call the Pulse Report, which gives a graphic indication of where we are as of yesterday, keeping in mind that the COVID vaccine summary report that we received from the state of Maryland may have a lag in data reporting. And I'll explain that a little more as I get into the Pulse Report. Nevertheless, Dr. Gayles continues to have conversations with Deputy Secretary Chan to emphasize that we would like to have as many doses as possible, the highest amounts as possible, as well as continuing to share our program expansion, including exploring new partnerships, which is what we've done this week and we did last week with our clinical providers and local hospitals, so that we too can move into our phase 1B and administer the vaccine to our senior population. We've also had conversations with the Medical Society of Montgomery County to request access to Immunet system, the ordering system for the vaccine, so that they too can receive access, which will enhance and provide a wider reach of getting the vaccine out in the community. Now, there have been some questions about how many vaccines we've ordered from this week to the following week. As of this Tuesday, we've requested 10,000 to 15,000 doses for next week. We anticipate that the total amount of doses that we've received to date will be depleted by tomorrow. Consequently, we won't have any clinics on Tuesday until we receive our allotment for next week. We anticipate that we will likely continue through phase one for the next couple of weeks, but that will again vary based on the amount of doses that's dependent upon our ability to handle our capacity, which is pretty much 2,500 to 3,500 a day, including our partnership with Fire and Rescue, who's made a significant impact on our current vaccination plan by vaccinating those first responders and those public safety officers that fall within 1A tier 3, and we're progressively moving through that. As of close of business yesterday, our overall vaccine total was 14,952 of the Moderna vaccines, and we expect, again, as I indicated earlier, we expect to use all of our 19,800 doses allotted that we've received to date by tomorrow, Friday, January the 15th. Now, if I could quickly switch over to the Pulse report, please. So it's a little bit out of sequence. If we could go to the first slide. So our current Pulse report is updated on a daily basis based on our information that we receive through our reporting processes and our team updates that are provided on a daily basis. We also receive a daily COVID summary report from the Maryland Department of Health to reconcile those numbers that we have. And as I indicated before, information that you see here presented this afternoon is from data that we received yesterday. These data are compiled and updated by close of business daily. Currently, as I indicated before, we have moved through 1A, and we continue to move through 1A, recognizing that those hospitals and those congregate living spaces, assisted living facilities, and nursing homes receive their doses from the CVS Walgreens partnership in collaboration with the state. I can not overemphasize that partnership and collaboration is independent from the Moderna vaccine doses that we receive directly from the state, but we are in discussions and partnerships with our hospital providers to use their vaccines to help move us progressively more deeper into our prioritization stages and or phases, as well as partnering with other clinical providers in the county. We've talked to Kaiser Permanente, to Kaiser Health to provide some support regarding our healthcare professionals. So we are expanding our capability and capacity as we continue to ramp up and receive more doses. Next slide, please. So this Pulse report illustrates where we are and what we've done as far as administration of all time. As of yesterday, it was 14,952 doses that we administered. We continue to burn through our vaccines at a higher rate than most counties based on our calculation. Again, these data may vary upon report or from day to day. But again, in incorporating our community partners, we are making significant progress through our tiering prioritization and through our prioritization phases. As of yesterday, we've administered 98%, and we continue to move through that. Next slide, please. This is just another illustration of our county-wide vaccine from all sources as compared to Maryland. It's our interpretation of the data, and again, may slightly vary from what's reported through other sources or may be reported in other dashboards. Next slide, please. This is a graphical representation of where our current vaccination pods are. These pods are by appointment only. I can not overemphasize that, is that it is a process that we've talked about and have said repeatedly on discussions and media briefings that it's by appointment. And once you receive an appointment and notification, these are the places and spaces that we currently have. This slide, this presentation may change and will change as we continue to expand our reach in the community and provide more doses in a diverse population. Next slide, please. Again, as of January the 12th, we've administered all of our doses that we received. We continue to be highly ranked across all of the data points that I present to you this afternoon as compared to the overall county, other counties, I should say. And so we take pride in this, and we have been very deliberate in our process. Next slide. This is just an illustration of the hospital administered vaccines. Again, we have been in conversation with our local hospital nexus, and we're working with them to partner to vaccinate and use their vaccines if they have any Pfizer doses or Moderna doses available. Next slide, please. And so who are we currently vaccinating? And so our tier 1A, our 1A tier 1, I should say, is that partnership that I've spoken of earlier with the hospital, directly with the state, as well as the CVS pharmacy partnership. Next slide. And so as we move down to 1A, tier 2, we vaccinated those folks who have been in the coronavirus testing spaces, our registration, our primary care, our emergency management system, and those individuals who have been on the front lines providing public health COVID response. Next slide. Tier 3, this is where we're receiving support from our fire and rescue to vaccinate our public safety community, as well as our fire and rescue community. We're progressively moving through tier 1A and tier 3, and we expect to move even deeper into tier 3 by next week by sending appointments to our behavioral health providers, our school nurses, our lab workers, and our funeral home staff and surgical centers. Next slide. And as I indicated before, in the next 2 to 3 weeks, although there is some variability around that depending upon the amount of doses, we are planning for, and we are prepared to move into our 1B category that includes our adults age 75 and older, public transportation workers, teachers and support staff, childcare workers, and the others that you see graphically displayed here. Our fire and rescue partnership will again help us as we navigate and move through our tier 1B process, in addition to the other partners that I've mentioned before. Next slide. This is just a priority pyramid. Next slide. And lastly, this is a county vaccination timeline that we put together for a graphical representation based on the week that we received the first dose, the week that we anticipate on receiving the second dose, and some of that is still to be determined. That concludes this presentation. And Lorna, back to you, subject to any questions that the media group has.
Thank you very much, Dr. Bridgers. And I do believe that the county executive has joined us. Mr. County Executive, if you unmute, and there you go. Opening remarks, please. Thank you.
I am actually here. Thank you. And thank you, Dr. Bridgers, for going ahead of me there. Gave me a moment to finish up something else I had to finish. So I want to thank everybody again for joining us today. I guess, what are we in month 11 of this? Last week, we shared our vaccine distribution plan, and we laid out how we were administering the allotments we're receiving from the state. And I know that you just got an update on that information. And over the past few weeks now, we've seen some extreme examples of how dangerous misinformation can be. And I'm concerned that there's misinformation being circulated about vaccines and distribution. And so I want to make some points about what's actually happening. Yeah, you guys who know me, you've heard me talk for a while. You know, I work very hard to share information with everybody, but I don't overpromise, and I try to present information as I have it. not necessarily the way I like it. So today I want to explain what we know about vaccine distribution and administration in the county. There are a lot of questions about vaccinations. I've been getting, when can I get the vaccine? Why are my friends in other states getting the vaccine and I can't? Can I register in advance? Can't you move any faster? Why is it taking so long? Why are you sitting on tons of vaccine? Why don't you get them out? And why are you sitting on doses? And those last two questions are particularly hard because they're triggered by, just one particular assertion that the county wasn't not administering the vaccines and sitting on them, and that was completely false. First, let me be very clear. We're administering vaccines as we receive them. We don't have any unused vaccines lying around. And if there are a couple hundred doses at the end of the day, they are going out in the next day. There's nothing going to waste. We're not accumulating the stockpile of vaccines. They are going into people's arms the way they were meant to go into people's arms. I want people to remember that it's the state, not the county, that distributes vaccines. The district is a state or treated as a state, so they're a different case than we are. But in Maryland, the state gets the vaccines from the federal government. They have not been given their full allotment of what they would ultimately get, so their number changes. And then for the past 4 weeks, we've been receiving our share of the vaccines from the state. Each week, we get 2 to 3 days notice. Usually somebody gets called on Saturday until we have that information. And so people who've looked at our chart about when the vaccines are going out and what the tiers are, and have asked us, why don't we have dates? I can't put dates on a chart if I don't know how many vaccines I'm going to have. It is impossible. And I don't want to put hypothetical numbers up there only to disappoint people. I mean, I could make a chart with made up numbers, and then most likely we'll be walking those numbers back. And so as soon as we get real numbers, as soon as the state starts giving us more than 1 week or more than a couple of days notice for the next week, we will provide additional information so people can see how we're moving through the different groups. But right now we don't have that information. Each week our clinics have been able to administer all the doses received. The chart, that Dr. Bridges shared with you makes it look like we hadn't administered all our doses, and it shows 19,000, whatever it was, and we had administered 14,800. So if that chart reflects data, for example, from the first, Wednesday and Thursday, or Tuesday and Wednesday, and I received my doses Tuesday afternoon, and they start really going out in mass on Wednesday, it's going to look like we've got a lot of undistributed doses. My percentage of doses is going to look lower than any of us would like, but it's lower because the doses came in and we haven't had the days to get the doses out. So if anybody knows anything about graphing and data, how you present data can sometimes be misleading. And that chart, the way the state is structured, it doesn't really give people a picture of how we're doing relative to how doses are coming into the county. Some have asked why we don't have staff working through the weekend right now. And I emphasize right now, it's because our public health and logistics staff are pretty much exhausted. They've been working nonstop since this pandemic began more than 10 months ago, and they're tired. And since we can get all the vaccines out before the next load arrives, we're trying to give people a break, and knowing that when our doses hopefully start increasing, that these folks are going to be working on the weekends too. So this momentary couple of days off on the weekend is going to lead to a period when it's all hands on deck 7 days a week. They're working as much as they're needed, but we don't need them right now because we can get the doses out. That's certainly the number that we've been given. We can and have used all the doses before the next supply arrives, and we expect that to continue. We've got 19,800 doses so far for 750,000 people who are likely eligible for those doses. Some will receive doses directly from hospitals or from nursing homes. which are under separate contracts from what's given to the county health clinic. But most people in the county are not going to get the doses there. They're going to get it from, at this moment, from the county. And the two vaccines that are currently available require 2 doses about 4 weeks apart to be fully effective. And this is something I want to make a point and emphasize. So in the week of January 27th, we're going to need 4,200 doses for the people who had received or had already received their first shot a couple of weeks ago. That'll be 4 weeks. Even if we receive 12,000 doses that week, there are only going to be 8,000 new people who could receive a dose because 4,000 of those doses are going to be people's second doses. The next week, February 3rd, we need 8,600 of our doses for the second shot. So if I receive 16,600 doses, only 8,000 of those doses will go to new people. And to put this in perspective, if our population of 75 and older is about 70,000 people, if I only have 8,000 doses a week that are free to go to new people, you're looking at 9 weeks. So this is why myself and the other county executives, all of us have been appealing to the state, which really doesn't control it in the end, but to our federal delegation to get the doses out as quickly as possible. We can do more, we can ramp up, and we can scale, but unless we get more doses, it's going to be very hard to move quickly through the remaining population. If I were to get 30,000 doses, 4 weeks later, I'm going to be in a week. If I got 30,000 a week, 4 weeks later, I'm going to have to revaccinate 30,000 people. And if I'm going to do more people, I need more than 30,000 doses. So I just hope you guys get the sense of the bottleneck that we're in right now and how the bottleneck is really created by the lack of doses we have. Like I said, we've talked to the state about this. We've raised this issue. We're trying to work with them on some other things, particularly on a uniform platform for registering and scheduling people. It is crazy that 24 counties are having to scramble around to create a platform when one platform could be created centrally and could effectively be given out to all of us. But again, I want to reassure people that we will get the vaccines out that we get. People want to know why other states are, sometimes getting, well, they seem to be in different stages. It may be that states don't follow the stages the way Maryland set up the stages. It may also be that other states had larger allocations, or that within states that counties have had larger allocations. I looked the other day at Fairfax County and Montgomery County, and Fairfax County had vaccinated, more people than Montgomery County. But when you consider that we vaccinated every person, we vaccinated everybody we could with every dose we had, the fact that they had more vaccinated people tells you they also had more vaccine. And so when you compare numbers with other jurisdictions, it's the amount of vaccine that determines how fast we move through these links here. You can go to our website and there's a link displayed and you can see all this information. We think February, hopefully, is when we're going to be able to start getting to 75 and older folks who aren't in nursing homes. It's a very large cohort in other states. Like I said, they may have moved there, but they may not have completed stage 1 and still opened up to what in our state is 1B. I think what else I want to add to this. Basically, I hope that, and I think Dr. Bridgers touched on the major points here. We are adapting as fast as possible. This whole coronavirus has been a real test for everybody because the county, and not just Montgomery County, no county had the health departments or other departments or the logistics, any of the tools that were needed to deal with the pandemic that threatened to infect everybody in the county and requires us to vaccinate pretty much everyone in the county. And so we've been flexible. Other jurisdictions are going through the same thing. We are learning on the fly. We are adapting. as we go through this. This is why we talk a lot to each other. We try to learn from the other jurisdictions as they move along. But we are doing everything we can. And I'm really proud of the people who are working in the county and the work they're actually doing. They're not only making heroic efforts, they're actually getting the job done. So in the meantime, we're going through this, another high level of cases in the county. And obviously people didn't take the advice over the holidays of staying home and not going to group gatherings. And so we're paying the price for it now. So now we're working as always to try to test as many people as possible, bring these numbers down. So please, enough of the partying. Please maintain a physical distance and wash your hands frequently and wear a mask. We are reasonably close to getting out of this. I'm not going to give you a date any more than I gave you a date on other things earlier when we were talking about them in the spring and summer. But we know the vaccine's here, and we know that the supply is going to determine the speed with which we move through this. Hopefully, the supply will increase, the number of companies providing vaccines will increase, and this will not take as long as it would appear it's going to take based on the current suppliers and the current number of doses that are being given. And I'll stop there.
Thank you, Mr. County Executive. Dr. Stoddard, opening remarks.
Good afternoon. Thanks to everyone for coming back and hearing us again. I have a few points I want to add to, and I'll stick to the vaccination because I think that's mostly what everyone wants to hear about this point. 42,000 people are now registered for our alerts on our website. We encourage others to go there. We sent out our first alert this week. We're looking to get more efficient and have, hopefully as we get more information, we'll have it to provide. Our goal is to have, we're trying to get some portals up for our 1B folks over the next several weeks, just to make sure that we have avenues through which people can begin to pre-register. And so we're working on making sure that we have IT systems and other things in place for people to begin to, prepare for the 1B phase, as we know that, it's coming quickly. The alert system will be your best mechanism to get a direct receipt of that information, but we are working with a very diverse communications team to ensure that we get the message out there, particularly to our populations that have been so disproportionately impacted by this event in our African American and Latino communities, as well as particularly zip codes throughout the county. We are already working with, I think we've talked about the school system, with our food provider networks, others to begin their prioritization process, recognizing that, as we get into 1B, there will be need to ensure that, phase 1B, priority group 1B, tier 2 is a very large tier, and we're going to make sure that we well stratify even within that population who needs it first and who is the less exposure because they're in a warehouse, for example. And so we're working on all of those details as we speak now. Dr. Bridges alluded to, but we are really looking to ramp up our partnerships with our other healthcare providers. We will, we are not receiving the vaccine that we're capable of distributing now, but we also know that the private sector the private healthcare network is going to be absolutely critical and necessary to ensuring that we get to the final quantities that we know we need as a county to ensure that we get people vaccinated as quickly as possible. And so as the vaccine ramps up, the county will ramp up, but we are also going to need our private sector providers to be involved in that distribution process as well. So we're starting on those. We're not starting on, we're continuing and building out those relationships right now. For anyone who was out to visit or has seen our public safety partnership, we're very appreciative of what Montgomery County Fire and Rescue and Montgomery County Police Department have been able to organize at the Public Safety Training Academy. It supplements very well the efforts of Montgomery County Department of Health and Human Services. We've actually made a lot of progress by adding those additional clinic opportunities and getting through more population. I would expect, just given the rates of public safety partners that we've seen come through there this week, that we'll be able to use the public safety clinic to leverage additional partners or next week, as Dr. Bridges alluded to. And frankly, we've already started planning and talking about how the fire rescue public safety clinic opportunities might become mobile in the future, so we can begin to do things like address our senior community through Leisure World or Asbury or Riderwood, some of our our large senior communities where we know have a large number of people over the age of 75 and ultimately over the age of 65. So that planning is well underway and will be ready in place. We know the governor is talking at 5 p.m. today. We frankly have no idea what he's going to say about vaccinations, but we're prepared for a shift that could occur, whereby we focus on older adults more. But we have no information to say that's what's going to be said. But obviously, we're waiting to 5 p.m., but sort of preparing for what we think could or might be said. So I think I'll stop there, and I think we can entertain some questions.
Okay, thank you very much, gentlemen. And now the first question comes from Chris Gordon, NBC4, and it is about vaccinations. Chris? On mute, you're on the phone. You need to unmute, Chris.
Yes, thank you.
There you
very
go.
much. I am on the phone. Council member Evan Glass put out an email today with his, what he calls this Gazette, saying we are only receiving half of the vaccine that we have requested from the Maryland Department of Health. In short, we need more vaccines provided to us. Is that true? And how frustrating is it? And this is to all three of you.
Sure. Good afternoon, and thank you for that question, Chris. I'll start and I'll ask Dr. Stoddard and or County Executive Elrich to add to anything. I would say it's more so challenging as opposed to frustrating. The challenge is that the weekly allotment is dependent upon our schedule. So our schedules are dependent upon the weekly allotments. We may request a higher allotment and may receive half of that allotment. We have no control over that, and is based on the state's prioritization distribution process for that week. We have built a plan to handle the current capacity at 2,500 to 3,500 vaccines per day, with some variations depending upon those number of appointments that are in the system. Let me just clarify one point. We're not going to pause any vaccine clinics that we have. We receive the allotment, the weekly allotment. We build our vaccine clinics on that allotment, recognizing that some individuals may not attend their appointments. We open those appointments to those individuals on a waiting list. If those vaccines that we've allocated or earmarked for a particular day or clinic, we bring those back and put them back in our storage center. We use those vaccines, as County Executive Elrich indicated in his remarks, for any future clinics. Monday is a holiday, and we won't be vaccinating any folks, and we will continue to use whatever doses that we have left over from tomorrow's clinic on Tuesday morning. We typically get our allotment on Tuesday, and we build around that in the afternoon because there's some clinical procedures that we need to adhere to before we actually can administer. So it's very challenging in trying to plan out. We've planned out for as many doses that we have now, and as Dr. Stoddard indicated, we planned out for a ramp. So if we have 3, 10, 15,000 doses, we will get those shots in folks' arms. And if we get 49, 50,000 doses, we will get those shots in folks' arms as well. That's the strategy that we've had, and I'll stop there and turn it over to others for additional remarks and or comments.
And I just want to say the question focuses on the statement, we are only receiving half the vaccines we have requested from the Maryland Department of Health.
I'll give you the details, Chris. So on Friday, January 8th at 12:11 p.m., we requested 10 to 15,000 doses through the state system. We received 6,700. This past Tuesday, which would be the 12th, we requested an additional 12 to 15,000. We won't know what we're awarded until likely Saturday. But that's that's the timeline of when we requested for last week and the timeline of what we requested for next week. And we that's, I'm looking at the emails where those were percent.
And Mr. County Executive, you said people are asking you why other states are administering more vaccinations. And you said because they have more vaccine. Why do they have more vaccine than Maryland?
But Chris, this is something we don't know. I mean, this vaccine comes from the federal government. If we don't feel like we're getting, our share of the vaccine, but we're not the largest state in the union either. So it's really hard to say why. I don't understand Donald Trump and his administration. I don't think anybody else does either. But they did have a policy where they were trying to hold back half their vaccines for a second dose. So that limited the amount of supply that was going to go out. They've said that's going to change. Biden has said he was going to change that policy. The state was not given, if there was an allotment that the state was going to get of total vaccine, they were not given that all at once. And so the state gets vaccine from the federal government and then apportions it. It would be a lot easier to understand our share if we understood the state share. And this is why, like I said, transparency would be helpful. It would be easier to understand why we got 6,700 doses instead of 10,000 doses if I knew that the state, got a smaller allotment than they hoped, and they do have 23 other counties plus us to distribute to, and then you can see whether the number makes sense. But the frustration of myself and other county executives is we're playing in the dark. We've issued this, we've talked about this before in these meetings about some of the communication we're not getting. I just wish everything about the vaccines were up on the table and transparent. We know what the feds gave them. We know what they're holding. Then we know what we're getting. And then we can say, this is totally outrageous and unreasonable. It just seems to me it's too little, but I don't know whether it's too little because they don't have them, or I don't know if it's too little because they're not distributing them fairly.
Thank you.
Thank you. Reporters, do remember to identify which outlet you represent on the chat box so we can toss to your questions. And next is Kate Ryan, W2P, with questions for Dr. Bridgers and also for the county executive. Kate.
And thank you very much. Dr. Bridgers and Dr. Stoddard, I know there was mention of some of the firefighters surveyed having a little bit of, our first responders, a little bit of hesitancy. Has that changed? Have you seen a change in that? And in terms of distribution and appointments, I saw that Harford County sent out a note this morning telling people, please, no walk-ups for vaccinations. They have to be appointment only. Are you getting a lot of that as well? Are people trying to come to the sites without appointments?
So thank you, Kate, for that, for those questions. I'll refer to the former to Dr. Stoddard regarding the surveys and where we are with fire and rescue, and the latter question regarding appointments. We have not seen as many or experienced as many challenges with folks coming in without an appointment. We do have reminders set forth regarding appointments in the announcements that they receive. We've had a couple of instances where individuals have come in indicating a name of someone on the appointment, but our a verification process requires that if it's a provider or anyone coming in for an appointment, they must show an ID or manifest with those entities who are scheduled to receive an appointment. So we haven't seen many challenges with the appointment process. So hopefully going forward, it's very guarded as far as sending out the information. We haven't had any challenges with folks forwarding the URL or any links to sign up for appointments, and we monitor that rigorously.
Mm-hmm. Dr. Stoddard?
Yeah, to your first question, we have seen some hesitancy amongst our public safety responders. We entered this week with approximately 3,000 appointments, and I think by the end of today, we'll probably have vaccinated about 2,200, which means that we have not filled out all 3,000 spots and have about 800 vacancies that have, they've been moved over to our other clinics. It's not unused vaccine, as the county executive alluded to. It's just that they're not being utilized in public safety clinics as we thought. We believe we have between 6,000 and 7,000 public safety partners of all types. And presumably some are not available this week because they're out or on shifts or can't be released. And so we expect that to continue into next week. But obviously, for us to have 6,000 to 7,000, for us to have 2,200 people commit to take it this week is not ideal by anyone's account. And so we're hoping that we can encourage. And again, I think with vaccine hesitancy, and again, I want to make this clear, this is something that's being seen in their hospital settings too. So it's not exclusive to our public safety partners. There is a fair bit of desire to see what happens with colleagues before they move forward, and we've seen that in various settings, not just in public safety or in the hospitals, but in many other areas too, even in our primary care providers. And so obviously we're hoping that, you know, they've been slow to uptake, slower than we would have liked, but they'll come on board over time. But as we've talked about, we're not waiting for people to get vaccinated who are in these categories. If we don't see enough registrations coming in for a particular category, we add in the next category. Just like, you know, I think the governor alluded to this, and we've actually used this terminology as the Southwest boarding model, where just because you're in boarding group 1A, if there's not a line for 1A, they're going to start adding in 1B. And if you happen to be a 1A and arrive late, you can get added into everyone who's boarding, but your spot's not being held for you until you show up.
Got it. And can I follow up to either one of you on Governor Hogan did say that when he added teachers to 1B, that he hoped that by the end of this month, you could start getting teachers vaccinated. What is your thought on that? And now the schools say they won't come back till March 15th. Does that give you a little bit of wiggle room in getting teachers as a group vaccinated?
So go ahead, Dr. Stoddard.
Yeah, not much wiggle room, unfortunately, because if you look at it this way, if we start around February 1st, dose 1 of Moderna is February 1st, hypothetically, you have 28 days till dose 2, and your full immunity protection is typically 7 to 10 days, not even full, but the 95% that we often talk about is 7 to 10 days after that second dose. So that's about a 5.5 week process. So if you start February 1st, and if you're looking at March 15th, there's not a whole lot of wiggling room there. We would like to start these categories as soon as possible, but that's incumbent upon the state giving us enough vaccine to do so. We should, I mean, I think we've seen from Anne Arundel County's county executive today talking about the fact that, you know, we should be in 1B now. There are counties in the state of Maryland who have finished up their 1A category and are just sort of waiting because not everyone's in 1A, which that tells us is the state has to get more accurate with its distributions instead of feeling like they need to give everyone an equitable amount in terms of their population, which candidly, they're not really doing that either. They need to be getting to the more doses to the people who have people in 1A to vaccinate so that we can all get into 1B together, because the point of the concern is if, for example, Garrett County can open up to 75 and older or to teachers, you're going to have a mad rush of Montgomery County 75-year-olds or Howard County 75-year-olds going to Garrett County, and they don't have the infrastructure nor the vaccine to support that. So I do think we're hopeful with the governor's talking today that perhaps we can get some better and more appropriate distributions of vaccine to address getting us into these 75 and older categories. The report from earlier this week said that there's a lot of vaccine that's sitting at the hospitals, that the hospitals uptake has been too slow, that needs to be transitioned over to other people who are waiting to receive it. And we're hoping, again, that's something the governor talks about today. We've said basically early February is where we think 1B will really be ramping up, but that's only because we're prognosticating based on the amounts that we're getting right now. If we get a lot more doses, we can get there faster, but that's what we need to happen.
Sure. And,
Thank you.
And Kate, just to add to Dr. Stoddard, I know he and I have been in conversation with MCPS once Fire and Rescue has moved through their vaccine based on the prioritization leveling that we provided to them. We're going to incorporate them and leverage their ability to vaccinate folks and help with vaccinating the educators and staff as well. So that's another piece that Dr. Stoddard and I are working with as we continue to ramp and build up to that level.
Got it. Thank you.
You're welcome.
Thank you. Next question from Natalie Rubino, Fox 5 DC. Natalie?
Hi there. So this is probably for one of the doctors best. I have two questions. The first, I know the county executive mentioned that the second dose is going to complicate things a bit, slow down the distribution. Other than getting more vaccinations from the state, is there a way around this to stop this slow? I assume you can't skip the second dose of the vaccine.
Hi, Natalie. Thank you for that question. And I'll just start, and Dr. Stoddard can add as we've been tag teaming the responses this afternoon. So our level of effort is dose dependent. However, our understanding, as far as my communications with Dr. Gayles and the Maryland Department of Health, is that the primary and secondary doses are independent. Our primary dose will continue to move upon the request. And then as we get into the second dose, we will receive that dose similar to this week. We received 6,800 doses. We receive 100 doses for that first week, for the first cohort of individuals that received their doses back at the end of December. And so that's the plan moving forward. As Dr. Stoddard and County Executive Elrich has indicated throughout our discussion this afternoon, is that we're working with Maryland Department of Health. We've clearly set our needs based on a weekly basis and what those primary and secondary doses are. The system, PrepMod and Immunet, also tracks those individuals who've received a first dose and a second dose, and through the system, they will receive a notification of when they come in for that second dose. As an added measure, those individuals that are receiving their vaccines now will have the projected or estimated second dose date written on that CDC vaccination card, so that as a reminder, in addition to any electronic reminders. I'll stop there, and Dr. Stoddard.
Question as to whether second doses are given or not is really a federal question, and just to be clear, this is a complicated scientific question. There is strong evidence to suggest it may be, from a public health perspective, beneficial to give more people first doses and delay a second dose. But from the counter side of that, if you give only first doses, you may actually be allowing the virus to be selected. You may be selecting for virus that escapes vaccination more easily by doing it. So it's a complicated medical question, a complicated scientific question as to whether you do it or don't do it. There are pros and cons to both sides. So I think what we're likely to do in Montgomery County is to try and align with our regional and state partners so that we're all being consistent, because I think one of the things we don't want to have is messaging inconsistency and, I'm getting a second dose here, I'm not getting it here. I will say that one thing that is clear, and I think is probably where we'll end up falling on this, is that the CDC just released over the last 48 hours that delays in second doses don't seem to have any impact, at least if you're 1 or 2 weeks behind the 28 days that you are supposed to get vaccinated a second time. There can be delays and it not impact your final immunity totals. And so that gives us some more latitude to do second doses, particularly as we get into populations where the risks are so high in our older adults, for example. So there is some flexibility there. I do think not just in terms of the state receiving more vaccine, but I think as we're, about 57% of the vaccine in the state of Maryland so far, at least that was the number earlier this week. I have not looked at the number today. So just to give you some context, it has been going to our hospital system. Our hospitals will finish vaccinating whomever amongst their staff is going to be vaccinated. And they're going to be able to transition over to other categories as well, or have the vaccine they're receiving be transitioned to over other areas. So independent of just the state receiving more, we'll be able to reallocate what's being received by the state, or the state can reallocate what the state's receiving, frankly, to other areas to allow more progress into tier 1A and into tier 1B.
That makes perfect sense. Thank you. And then second question, I assume this would be far down the road, but we have seen states and cities with mass inoculation sites in stadiums, in arenas. Obviously, you don't have the vaccinations for that right now, but is that something that you are considering for when Maryland does get more vaccines?
Sure, Natalie. Thanks again for yet a great question. So yes, as Dr. Stoddard and I indicated, we have been in partnerships with our hospitals to increase the number of sites to do larger scale vaccinations. multiple times a week, and including on the weekend. We've also been in contact with some of the hospital partners who aren't able to have multiple sites, but to do one large scale sites. We've looked at various places as the Soccerplex, the fairgrounds, to look at a larger vaccine processes. So those strategies are in our plan, and we're planning to implement those as we increase or receive more doses.
Thank you.
Thank you. Next and last question comes from Brianna Adikusuma from Bethesda Beat, and it's about vaccines again. Brianna.
Yes, thank you. I have a few questions regarding vaccinations, but I'll start with my first one. Thank you, County Executive Elrich, for explaining the timing of the vaccination orders more. I did have some clarification. I know that we published an article the other day that the state and the county had some disagreements about when orders were made for particular weeks. So is there a particular day that the county is making requests from the state? And how does that timeline? For example, if you order on a Friday, is that for the shipment to be received on the following Tuesday? I have a copy of the Friday email that you had mentioned, Dr. Stoddard, and the governor's spokesman was arguing that the county had actually asked for 5,000 to 10,000 for the current week that we're in, and that request that was made on Friday was 10,000 to 15,000 for the coming week. So could you explain that a little bit more?
Sure, Brianna. Thank you for that question. So as a result of the questions regarding when we actually initiated the request and followed up via email with the Maryland Department of Health, our vaccine inventory summary indicates that when we did our first outside of the state allocations and our requests, the log indicates that one of the requests went out on a Thursday. That was December 31st, 2021. After that, and that was for 5,000 and 10,000 doses. And I'm literally looking at the log as we speak. On the following Tuesday, last Tuesday, January the 5th, 2021, we put in a request for 12 to 15,000 doses. Again, this Tuesday, we put in a request for 12 to 15,000 doses based on the current availability that the state has provided. So the answer to your question is we make the request on Tuesday. We follow up based on our plan projections and our scheduling for the following week, throughout the week with state, to get some indication as to the amount of doses we will receive and expect to receive so that we can plan accordingly. That conversation continues throughout the week, and sometimes around the weekend, maybe Friday, maybe Saturday, we are given the notification of the amount of doses that we are scheduled to receive on that coming Tuesday.
Thank you. So the Friday request was meant for this current week that we're in. Is that correct?
Yes.
Okay, thank you. My second question.
And just so we're clear on that, it includes the dates and clinics. So I'm not sure how there could be much confusion about that. It says we'll be doing a clinic on January 11th, for example, correct, for 2000. So I don't know how we could have ambiguity about when the request is for, because it says the dates of the clinics that you're going to use the like you basically have to explain how you're going to use the vaccine that you're requesting. And so I'm not sure what this is all about per se. I mean, I think generally speaking, we weren't sure we were going to get 10, 50,000, but I think we were pretty astounded that we got less than the previous week. And I think that really, we want to be showing progress every single week. So from going from 8,600 to 6,700 is not the direction that we nor our residents are expecting. And we're hoping that the state can remedy that moving forward. Our goal is to keep making progress and building and showing success every week and showing that we can distribute what we're provided. And we never want to see less doses the following week from what we provided the previous week.
Has the state provided any explanation of why the doses were cut?
Not to my knowledge. And Brianna, let me just be clear, for the amount of doses that we requested on this Tuesday, from 12 to 15,000 doses, we haven't received any indication of that request, how much we will be allotted for the coming Tuesday. So I wanted to be clear on that. We don't know yet. We haven't received any indication. We did put in the request this past Tuesday.
Thank you. I know that County Executive Elrich mentioned that you all are going to be expecting to begin weekend clinics soon, and that you all are trying to give the current vaccinators some time off, some rest, since they're doing this every day. Is it possible that the county could hire more staff members or partner with local organizations to add more vaccinators so that we could do clinics?
Look, we're trying to, yes, we're looking for partners. We're working with people. I think there's some people we're working with I can't discuss right now, but we're actually looking to find large organizations or smaller organizations that can help us. And frankly, if, you know, in the normal course of things, like with the flu, you would go to your doctor or you would go to your Kaiser or whatever else it is. If the state could figure out that they're going to let doctors do this in doctors' offices and make requests for vaccines based on what they would administer in, you know, a reasonable length of time. You can't give them a bunch of vaccines they don't use, but we could bring more people on board, and we could help the distribution of vaccines by having as many people as possible able to do this. So we're looking, and you know, we are talking about ramping up. We know where we want to get, and so when the vaccines get here, we're trying to make sure we've got partners in place that we can then go out and distribute the vaccines.
Thank you.
But we know what we're driven by. You know, I will say, you know, there's a question in the chat from Dan that's relevant to this. So you mentions, why don't you just ask for 40,000 vaccines? Because they don't have them, and they're not going to give them to us. And because it would be way disproportionate given the amount of vaccine they have to what anybody else would get. And if everybody asked for what they absolutely needed, the state doesn't have that for anybody else either. I mean, this is really a combination of the limitation of what we get, and probably a limitation of what the state gets in any given time. I think I remember last week, and Earl, you could correct me, we had a state dashboard up where they showed the number of doses they had, and then the next day that the number of doses increased by 100 and some thousand, and that was another federal shipment. But that may have been their shipment for a week, for all I know. This is why I'm begging for some transparency so that I could give you an honest answer based on everything we know. And we're all left to try to figure out what is going on at the state level. And if they don't have it, they don't have it. And nobody's going to get mad at them for things they don't have.
Right.
I want to really say something on this point, because there's no value to our residents to having a back and forth with the state on this issue. We're making this very apparent. We have more capacity and can give out more vaccine. There are many other, not just counties, but organizations across the state that have not been as successful as Montgomery County at getting vaccine out. The state has a vested interest in getting our residents vaccinated and should be providing more vaccine to the people who have demonstrated that they can actually get the vaccine out. And I think that's all we have to really say about this particular issue. The state's interest and our interests are aligned, which is to get people vaccinated. And we just encourage the state to give more vaccine to the people who have demonstrated that they can get the vaccine out.
Right.
Along those lines, I'd like to add, Brianna, that we are not pausing any of our operations. We're going to continue to vaccinate with the amount of vaccines that we have, recognizing that individuals may not attend an appointment. We will bring them back. We will continue with the next day to vaccinate until we receive our allotment and continue to move in such manner. So I just wanted to make that clear that we aren't going to pause our operations. If there are any, if there are, for example, 100 doses left over after tomorrow on Tuesday morning or whatever time we have, we will administer those 100 doses until we get our allotment, typically, which comes early in the morning.
Right. And kind of following up to those, I know that Dr. Bridgers, you mentioned that we have a capacity of up to 3,500 a day, which would be 17,500 for 5 days a week, if I'm correct. I know that we're requesting 10 to 15,000 and the state is not giving nearly that amount. Is there a reason why we're not requesting more, or has like the state provided like a capacity, a maximum that the county can request, realizing again that they are not even giving you what you are requesting?
So Brianna, again, great question. We have no cap on the amount that we request. We realistically project based on the number of clinics, as Dr. Stoddard indicated. We may project a range from 10 to 15,000 doses, recognizing that we have 12 sites scheduled for the week at 1,000 dose a site. So that's 12,000 doses. And so we try to project out as best as we can. You're absolutely right that the range and the capacity may exceed what we offer, but we anticipate that there may be some additional appointments that's not attended to, which will allow us to either increase or decrease accordingly, which has been the pattern.
Thank you. And last question, I promise. Has the state provided any indication of when they will allow private medical providers to start ordering doses to help administer them?
Nope.
Again, great question. We have not received any indication. We have been in conversation with the Medical Society of Montgomery County, and we've asked them to request directly to the state that they have access so that we can increase our provider networks. As we've done before, not only with the hospital, but other provider agencies such as the FDA. So we have asked that the Medical Society of Montgomery County get involved and be a voice to get doses in private providers. We understand that many folks may be reluctant to come to a government county-led site, and they may be more comfortable to go to their provider sites. And so that's one important influence to get more folks vaccinated.
Dr. Chan from Mountain Department of Health during their last press conference had suggested that perhaps in 1B, but that, as I understand from Dr. Gayles, that was discongruent with some of the conversations they had at the health officer level. And so we certainly would encourage the state to begin including, I think Dr. Chan had mentioned federally qualified health centers and other, not necessarily an individual practice, but certainly others besides local health departments, hospitals, and the pharmacy process would come on board. And we certainly encourage whatever increases we can see in terms of diversity of availability. In terms, ease of access is going to be a big necessity for us to get this process to its completion.
Great, thank you so much.
All righty, thank you, everybody. That was the last question from reporters on the chat. Any closing statements, Mr. County Executive? Good to go?
I just hope everyone maintains, you all maintain your personal patience and in terms of dealing with this. It's really a shame when you see people getting impatient and feeling like I can't take being cooped up anymore. It's like you're so close to being able to get to the end of this. And at least you can get to the end of this. So why do anything to jeopardize your ability to get there? So I just hope that people think about that before they say, I just can't deal with this anymore. You've done 11 months of dealing with this. Let's get to the end so we can get out of it together.
Thank you, Mr. County Executive, Dr. Bridgers and Dr. Stoddard. And thank you to the members of the media. We're done for today. We'll see you next week. Thank you. Have a great afternoon.
Stay
Bye.
safe, everyone.